My name is Neil Forbes. I'm a Royal College of Veterinary Surgeons specialist in zoo and wildlife medicine, brackets avian, in other words, avian medicine. I've worked in first opinion, referral practice, academia, working with birds and exotics for 35 odd years. And I'm delighted and proud and pleased to have been working with F10, I'm a great advocate and believer in it for the last 20 years. And having now left clinical practice, I'm really pleased and proud to be veterinary advisor for health and hygiene. So it's my pleasure today to address you about the use of F10 in controlling respiratory infections, specifically in birds of prey, but equally relevant to hoopara bustard and other birds come to that. So first of all, let me just discuss, what makes F10 different to other commercial disinfectants there on the market. And the answer is various different factors, but we'll run through those. We have safety testing of all finished products. So that means the end product as you're going to use it, not the individual constituents, which is what some manufacturers have test certificates on. These safety certificates have been conducted by government accredited and approved quality controlled laboratories. And we have safety certificates for toxicity in relation to skin, oral, in other words, drunk, eyes, the cornea, and also the respiratory system. We also have efficacy testing for all finished products, again, conducted by government accredited quality controlled laboratories. So the point is that Health and Hygiene is an ethical and moral company who believes that we should make available to you the results of all those test certificates. If you look at other manufacturers, distributors' websites, they may tell you that their product is safe and it's effective, but they don't provide you with those certificates. So Health and Hygiene is pretty unique in that respect. In addition to that, there are considerable amount of additional information, testimonials, as I say, all the safety and efficacy testing, also the application instructions for use of F10 in different situations, and very much more available on the Health and Hygiene website. So do please take time to have a look on there. So there's a range of quality products that you can have confidence in. All the test results are available for you on this link here to the website, with full details of dilution rates, contact times for the use of F10 products against different pathogens available on this link here. The application guidelines for use in different situations, for example, in pet shops, with use with birds, birds of prey, and also with other animal groups available at this link here. Health and Hygiene provides added value to all the products across its range, with training and education of distributors as well as clients and end users, with this and other similar presentations together with the comprehensive fact-packed website. And if there is information that we can usefully provide for you, which is not already there, we would be delighted to hear from you, and we'll do our best to comply with your wishes. So focusing now on respiratory infections in birds of prey. Let's start with Aspergillus. That's certainly the biggest and most important disease risk for us. It's true to say the spores of Aspergillus are ubiquitous. They're everywhere. They're in my office where I sit now. They're in your clinic where you're sitting watching this. They're where the birds are kept, and so forth. Aspergillosis occurs in birds in two different, quite distinct situations. Either, well, let's go back a step. A fit, normal, healthy bird of prey will meet Aspergillus spores on a day-to-day basis, but the level of spores they meet, as long as they are fit and healthy and well, they can cope with on a day-to-day basis. So one of two things goes wrong. Either the bird meets an overwhelming level of spores. For example, they are housed, caged, or kept close to or downwind from, and downwind could be a kilometer away, half a kilometer away. It could be a field of hay that's been cut and it's been turned by the farmer before the hay is made, before it's baled. It could be close to a compost heap to a pile of lawn mowing, more lawn mowings that are going rotten. It could be that the bird species is fed on contaminated seed. It's true to say that 27 to 56% of seed-based diets analyzed, they were diets destined for use for parrots that were analyzed, contained Aspergillus. So any damp or decaying vegetable material will grow Aspergillus, and any source like that. Another one that we've come across is shredded green wood bark used for the substrate on equine menages. If that is upwind of a bird collection, then birds in that collection will suffer. So birds exposed to overwhelming infection, and there are certain species of bird that are particularly susceptible in this respect. And those would be gerfalcons, that's the European gerfalcon, the gerfalcon, northern goshawk, snowy owl, juvenile redtail, some of the eagle species, bearded vultures. For any of those species, and there will be others out there that have not been published and identified as yet, if they are stressed, then that leads to a reduction in the immune system such that that bird can no longer cope with the level of spores which they would otherwise not have an issue with. So we all know if we get stressed, we mount our fight or flight response. So the adrenocorticosteroids are released from the adrenal gland. They give us energy to fight or to run away. But we also know that adrenocorticosteroid also acts in the body to suppress the immune system. So, as I say, diseases which we would otherwise cope with, we suddenly can't. Stress lasting for 10 or 15 minutes when one bird is upset is generally not a problem. But if one of these susceptible species goes through a period of initial training, through transportation, through quarantine, through mixing with a whole lot of other birds, sometimes even if they have different staff looking after them, particularly for in-print birds. In-print birds are really, they really require that day-to-day contact with the person on whom they're imprinted. And if that person goes away, I've had cases where the owner goes away for 3 days to attend a family wedding, and 10 days later, the bird has aspergillosis. So you've got to think about it as to what is causing the bird a stress. And in many cases, it's not a lot of stress in order to make the bird susceptible to aspergillosis. Okay, so that's how it happens. Here's a slide for you, just showing you under the microscope an image of Aspergillus growing on the microscope slide. So what can we do with F10 to prevent or to control aspergillosis? And the key thing really is fogging the falcon's environment at the time when the bird is at risk. So from our point of view, if we're about to export a group of gerfalcons, high-value falcons, from the UK to the Middle East, we will put those birds in a room and fog the room for 30 minutes, 2 or 3 times a day, for maybe 5 days before they leave. So we're making sure that we are cleaning the respiratory system. We're making sure the fact we've caught the birds up out of a hack pen and we've put them on a perch is not going to cause stress, and will not cause, or if it causes stress, it won't lead to aspergillosis. Birds arriving in another country, or having been through transport, or birds going into quarantine, again, it would be really, really useful to fog their environment at that time when they're stressed. And what are we doing by that? Well, we're reducing the level of Aspergillus spores in the air, because the fogging traps the Aspergillus contagious particles, drags it down as the mist of the dry fog settles. It drags it down onto a level surface and disinfects it. But it also means birds in that environment are breathing the F10 in and sanitizing their own respiratory system. So in the event that they have breathed in any contagious particles, which is pretty inevitable, then the F10 will control it. So the inhalation of the F10 will negate any contagious risk from pathogens that they may have breathed in. So just to reiterate, we would suggest fogging the birds for 30 minutes 3 times a day, prior to export, prior or during training, during quarantine. It's a great precaution. It's not a risk to the birds. It's very low cost. Yes, you've got to have a fogger, but the amount of F10 you're going to use on a daily basis is absolutely minimal, and yet absolutely life-saving. So we would suggest using for 48 hours prior to and during, for the duration of any anticipated stress that those susceptible species might be going through. How do we fog? Well, of course, you have to use a disinfectant which doesn't corrode metal and is safe for both the bird and for patients to breathe in, safe for their skin, safe for their eyes. And F10 is really pretty unique in that respect. And as I'm sure you will all be aware, F10 has treatment licenses for the control and treatment of respiratory infection in birds. So F10 fits the bill for use with fogging, and very few, if any, other products do the same. Foggers can be powered by compressed air, by electrical motors, by petrol or diesel motors, and the smaller the particle size that is generated by the fogger, the further the F10 will ascend into the respiratory system. So fogging should create a thick, dry mist so you can't see from one side of a room to another, and the surfaces should be just slightly damp, but certainly not wet. If they're wet, generally speaking, the droplet particle size is too large, or the fogger has simply been left on for too long. So say fogging for 15 to 30 minutes, 2 to 3 times a day is typically the optimal solution. When to fog? When you anticipate stress in the birds, transport, quarantine, change of location, husbandry, management, or even carer. Whenever any one bird in the group is diagnosed with Aspergillus, then obviously fogging the whole of the rest of the group because you know that they are at risk at that time. And typically when one bird is suffering from disease, either they've been stressed or, as we said before, they've been exposed to damp or decaying plant material. When treating a clinical case, generally speaking, we recommend the use of a nebulizer rather than a fogger. A fogger will normally create a particle size of about 5 mu. That's what we're aiming for, not bigger than that, which means they don't get a long way down the respiratory system. Whereas a nebulizer, what we're looking for is creating a particle size of 0.5 to 2 mu, and that means they'll be breathed in, inspired in right the way, and those particles go right the way down into the abdominal air sacs. So here we have an image of a static multi-nozzle fogging machine that is installed in a building. In fact, this was a very large building, and we had a whole number of these situated about 10 meters apart. That calculation was created on the basis of how far the mist would spread from one to the other to make sure the whole room was covered. This is a picture of the room when the foggers have just been turned on. They've been on for a couple of minutes perhaps, so we can't see to the bottom of the corridor. Once the foggers have been on for maybe 5-10 minutes, then you won't see more than 5 meters in front of you. And this is creating a dry mist. This system was used when we'd had an outbreak of very serious, contagious, airborne viral infection in this group of Hubara bustard. And I have to say that we obviously knew that a number of these birds would be carriers of this viral infection and would shed virus from time to time. But by introducing the fogging, we completely nailed the further instance of clinical cases, and really very, very effective. Of course, the temptation is once you've controlled the disease is for people to stop doing it. And I would urge you that with collections of birds of prey, when they're not a closed collection, you have birds going out for hunting trips, for competitions, you've got new birds arriving from markets or from dealers or being imported. So it's not a closed collection. Therefore, we know that contagious infection is always a risk. And therefore, the main thing is to maintain this level of infection control and biosecurity all the time to prevent problems. And this is really what we want to urge people to do, is to prevent problems rather than to treat them once they've occurred. So here we have a fogger in my own establishment. This is working on compressed air. This is a poultry house fogger which is a plug-in electric motor, and each of them are producing particles of somewhere around 4 to 5 mu. Other situations where we may use this from a therapeutic point of view, here we have a nasal infection in a parrot. Typically, there will be a background fungal, often a candida, can be Aspergillosis infection. Once the rhinolith is removed, so the picture on the right, you can see the rhinolith is removed. Obviously, we'll take a swab for culture and sensitivity, but in the meantime, we will instill some F10, F10SC, at 1 in 250 concentration, instilled with a syringe into that cavity, but also be using a nebulizer to control infection pending culture results. Sinus infections, also a common problem in birds of prey, and these are really very, very difficult to treat, even with full systemic antifungal, antimycoplasmal, antibacterial medication. These are very, very difficult to treat without flushing the sinuses through, just the same as sinus infection in human. And as someone who suffered from that, I really do sympathize with these birds. So typically these respond best to nasal flushing. Joe Falcon here, my hands on the left-hand side, head down, mouth open, and 10 mils of F10SC at 1 in 250 dilution being flushed through each nostril on a once-a-day basis for usually 10 to 14 days. Very effective therapy, which would not be achieved by systemic medication. And then if we look at Aspergillus, just to show you what sort of things happen, the first picture on the left shows you a granuloma within the air sac of a bird on X-ray. The top picture here shows you, again, Aspergillus granulomas in the caudal thoracic air sac of this falcon here. And then at the bottom, we have syringeal Aspergillus lesions affecting the syrinx here. And again, at a post-mortem sample here, affecting the syrinx on this sample here. So this is what they do. You know, once that Aspergillus takes off, yes, there are some very good antifungal therapies nowadays, but really what we must all be doing is preventing the problem in the first place. And then finally, when we're talking about control of respiratory infections, we must consider the control of chlamydia. And whilst I fully appreciate that chlamydia is much commoner and better recognized in parrots, waterfowl, and pigeons, it does occur in falcons. I have certainly myself dealt with 2 different pandemics of chlamydia infection in groups of falcons that had been stressed. Remember that chlamydia is spread by fecal and feather dust, so it's an airborne infection. And remember that if a bird has suffered infection, it would have been excreting infected particles, and those infected particles will remain viable in the hospital or home environment for up to a month. And a bird that's been treated for chlamydia effectively will not have a long-lasting immunity, so it can get reinfected from its own environment. So regular fogging within your hospital situation or your home situation, if you have a large group of birds, will reduce the incidence of spread of chlamydia from bird to bird or from the environment to the bird. And do remember, as I say, if chlamydia has ever been diagnosed in a pet bird or bird that lives in a home environment, then the home environment must be fogged to prevent reinfection, but probably most importantly, to make sure that there is no potential for the owner to contract infection from the environment. Now, you as a veterinary surgeon, if you fail to decontaminate the environment, potentially you could be sued for the owner then becoming ill themselves. The doctor doesn't know the parrots had chlamydia, but you did, or the bird of prey had chlamydia. Therefore, it's beholden on you to advise the owner to decontaminate the environment, and really fogging with F10 is the only way you're going to effectively achieve that. So just to conclude, it's really important message for you is that fogging is an absolutely vital tool. And in terms of fogging, as far as I'm aware, the only disinfectant that is safe and effective against these pathogens, but also safe to use for a fogger. It doesn't corrode metal, and it doesn't cause a problem to skin, eye, respiratory system, or the gut, to be used in an environment with patients and with staff. And then at the bottom here, we have some references for you based on respiratory infection, a lot of them referring to use of F10 in that situation. I would particularly draw your attention to the Health and Hygiene Bird of Prey application guidelines here. If you just click on that, that'll take you straight to the website. Hopefully you found that presentation useful. If there are more presentations or you've got comments or criticisms, we would be grateful to hear those, and hopefully you found it useful. I would encourage you to watch the other F10 presentations in relation to birds of prey or other situations if you're involved with those. Thank you very much for your time. Hope it's been useful, and we look forward to seeing you again with other presentations. Thank you.